All righty. Well, let's go ahead and get started. My name is Josh Schreiner. I am the Chief Product Officer at HealthEZ. I am joined today by Tammy Bergwald, our Clinical Director. We're very excited to talk to you today about our new medical infusion carve-out product. We launched this last year and have had some tremendous results for our employer clients as well as our stop-loss partners. So we'll spend some time today talking about how the program works, and we'll make sure that we answer any questions that you all may have. One of the things that's very unique about this program, and Tammy will get into, is the fully integrated care advocacy that is included in this product. Our goal here at HealthEZ is always to ensure a white glove member experience, and Tammy will get into describing how that works with this solution. So you might be asking yourself, what is a medical infusion carve-out? Many of you may be familiar with patient assistance programs. They have taken off in their popularity on the pharmacy benefit side over the last decade. HealthEZ was one of the early innovators in leveraging patient assistance programs, copay maximization programs to try to drive down pharmacy spend for level-funded and self-funded employers. We've leveraged that experience in our team of consultants to design a new product that now specifically targets medical infusions. There are three unique categories for this product that employers and members can take advantage of. The first lever is the manufacturer's assistance. So same concept as on the pharmacy benefit side, where we are able to work with the member, the physician, and our preferred specialty pharmacy to submit an application for patient assistance. These programs typically are needs-based, so qualification for them is dependent on family income and household size. For members that do not qualify for manufacturer's assistance, we have a second lever, which is leveraging our specialty pharmacy to dispense these high-cost medications. As many of you may be aware, there are a lot of pieces of pushback from providers, especially large health systems, in the sourcing of these medications. And so HealthEZ has developed a third lever that is really innovative and allows for the provider to submit a claim to our specialty pharmacy and is able to get reimbursed at their cost for the drug, plus 5 or 10%. This program gives three potential levers to reduce the cost on up to 275 high-cost specialty infusions. One of the greatest challenges facing self-funded and level-funded employers today is the rising cost of oncology drugs. We have seen over the last several years a double-digit increase in the PMPM spend of oncology for our self-funded and level-funded employers, and those increases are being seen nationwide with both large carriers and other TPAs. And this program is really based on our expertise in the pharmacy space. Tammy will get into describing how we leverage our advocacy to ensure no disruption to our members. But HealthEZ has intentionally included smart coverage design, one of our 7 core cost containment strategies, to really leverage the plan document to move patients out of the hospital when medically appropriate. And oncology specifically is not usually one of those due to the toxicity of the infusion. And so MICO, while it doesn't just target oncology, was really developed to lower oncology costs along with up to a dozen other disease states. So with that, I'm going to turn it over to our esteemed colleague, Tammy, and she will walk you through the member and provider experience.
Yeah, great. Thank you, Josh. Good to be here this morning and good afternoon also. But yeah, so I'm just going to get in. When it really comes to a program such as an Infusion Carve-Out, we all know that there are several components that really need to align just right in order for it to be fully successful, not to disrupt, any care, and then include the member experience too, which is so important, if not the most important, which is like, many other of our other programs here at Health EZ. We too have designed the MICO program to keep the member and their support system really at that core center. So we do that by connecting them to an advocate, one point of contact throughout their entire process. Typically, 9 times out of 10, by the time that the member's provider is ordering treatment, these folks will already be engaged with their advocate. So really that connection is already established prior to being identified for this program, which of course then leads to expedited process completion, and importantly, education on the program is so much better received by the member coming from their established trusted relationship with their advocate already. Not only does this advocate, walk alongside the members and their family, but they're really also here as that liaison, if you will, between, our prior auth team, the providers, our clinical pharmacy team, really making sure that all the connections are made and the process is moving along quickly and seamlessly as well. So with that said, what you're seeing here on the screen is our communication flow process. I wanted to just spend a few moments really providing like a high level overview of what this process looks like from start to finish, hopefully with the intent that you'll get a feel of how it's really different from any other infusion carve-out that you may have seen in the market today. And then in just a moment too, I would love to share with you a few examples that have actually went through this process with us. So you can kind of see too, on paper what it looks like. So the start of the process is really a member receives a diagnosis, right, which requires treatment with an injectable therapy that are required to be given in that clinical setting, like Josh mentioned, rather than a home or self-injectable, if you will. So typically these are your oncology, rheumatoid arthritis, MS, really those high cost medications that we're seeing the providers billing outrageously high dollar for. This then initiates the start of the typical pre-cert review process for medical necessity, which is completed by our utilization team. And here is where it gets a little bit different. After the review is completed, the provider is notified of the determination of the pre-cert along with the information of the program. And importantly, the claims payer details as well. So this communication is provided by two different ways. So first, the provider actually receives a warm transfer call by our clinical review team. Following that, they'll receive their pre-cert letter, which indicates not only the medical necessity determination, but again, how to submit claims appropriately for payment according to the benefit plan design and the SPD. During the pre-auth process, this is where the member is also assigned their advocate, who then connects with the member on the back end and is educating them on the program, really what it is, how it's going to work with their benefits, etc., and any other next steps that should be expected. Then our clinical team is going to outreach the member to evaluate the patient assistance program, etc., really screening them for which model is best, like what Josh was explaining, and their treatment. So the patient assistance program, the white bagging, or the cost plus model. Following the determination of which method is appropriate, the same clinical team then begins the outreach to the provider to really finalize the setup of the model. This may be attaining signatures on the MAP or PAP applications, setting up the shipment of the drug, or negotiating price. This is all done behind the scenes, and very importantly, there's absolutely no delay in care, nor is the member or provider being asked to move site of care, which we're finding is so great for our members when they don't have to move out of the hospital or out of that infusion suite, or even being asked, our members to establish care with another provider because the cost is a little bit lower down the street. And our members are still able to receive treatment all while this process is being set up too. And now one of the questions we get asked so often is, What if a provider decides not to engage and not work with our clinical pharmacy team and sends claims through the medical side? Well, we too have thought about that, and that was part of the reason behind the two-step communication that I mentioned just moments ago, the warm calling and then the changing the authorization letters to really reflect how the claim should be submitted for payment. If we do receive a claim, however, that was identified part of the program, it will be denied with an intentional denial reason code, explaining the claim must be billed appropriately through the specialty pharmacy, which will then force the provider to engage in the process. So as you can see, this is truly a carve-out program. It will also make it be required for a member's physician to really do their due diligence as a medical healthcare provider, which could be simple as completing or signing a PAP or MAP paperwork to see if a member qualifies for free drug. This is something that really should be standard process today, especially for people who are going through chemotherapy. But as we all know, it's not always being done, which in the end, really takes the stress and the burden off the members, really allows them to focus on their health and well-being. We're really, really proud of this program. It's truly been beneficial for not only our clients, but our members too, for so many different reasons. With us being our product, our team overseeing the entire process, including our advocacy, our authorization, our plan language, our customized letters, claims, all the way to our member experience team, really makes this medical infusion carve-out successful 100% of the time. And with that, Josh, I just want to share a couple of the cases that we have went through the process. So this first member was diagnosed with breast cancer, undergoing care and treatment at Indiana University. Member started immunotherapy with a drug called Keytruda, which is a very common immunotherapy drug that we see today. We see it on TV. We kind of see it everywhere. It treats over 19 different kinds of cancer today and can be used in adults and in some cases children as well. We're seeing the average allowed amount around $26,000 per cycle. And the cycles are usually 21 days or every 3 weeks. As we know with immunotherapy, sometimes folks are on these drugs for 18, 24 cycles, if not indefinitely, until progression of disease or toxicity, whichever ends up costing the plan hundreds of thousands of dollars. This member did not qualify for the patient assistance program, so the cost model was put and used in effect, and our clinical team was able to negotiate a price, saving the plan over $150,000 for this member's treatment. And this is again just the member's treatment that has been authorized today, so it could continue and save the plan money. And then the next case study, another individual who is undergoing breast cancer, significant treatment at Baptist Health in Miami. She had went through all of her chemotherapy. She was started on HER2 inhibitors with Perjeta and Kagenti. This is a combination therapy. It's a type of immunotherapy as well, just like the Keytruda. It can be used for a long duration. So both of these medications have patient assistance programs available, and which the member did qualify for both of these drugs. The member has been on these drugs for a long time. And like I said before, the provider should have filled out the patient assistance program, the patient assistance program forms. But we have done that since, and now we're saving the group over $500,000 over just these cycles that have been in place, and get potentially more savings, if the member's treatment is extended. So yeah, this is a little bit about, a couple of case studies and a little bit about the process. And with that said, I'm going to hand it back over to Josh to kind of walk you through the next steps and overall savings.
Absolutely. Thanks, Tammy. Just one other point on this specific case that we have pulled up in Florida. You'll notice in the center there's an allowed amount. So the 74,500 is PPO network allowed rate. Had the member not qualified for PAP, the actual cost to source these drugs was about $19,500. So you can see here, you're talking about a 3 to 4x markup on the cost of these medications. So leveraging either manufacturer's assistance, dispensing out of the specialty pharmacy, or cost plus, regardless on this case, would have saved significant dollars over leveraging the medical benefit plan. So we have another case. Keytruda is a popular medication. This is another example of a hospital in Atlanta where the members' treatment through the medical benefit would have cost this 300 life employer almost $630,000. With the medical infusion Carve-Out, the MICO program, and the cost plus methodology, we were able to save this employer $425,000 just on one patient. One thing I do want to mention, up at the top of your screen in the taskbar, there should be a Q&A section. So as we're going through these slides, feel free to drop in your questions, and we'd be happy to answer them when we get to the Q&A portion. So next steps, if you are interested in either a new group or an existing group leveraging this program, HealthEZ is happy to provide a savings analysis. If they're an existing customer, we have all of the necessary data to have that analysis run. We will work to see what the savings would be depending on each lever. There are times where the manufacturer's assistance lever doesn't save as much, or the savings is relatively similar to either the specialty pharmacy dispensing or the cost plus program. So depending on your group's utilization and interest in deferring these costs, the programs that you select within MICO are flexible. So you could set up the product without the manufacturer's assistance and just leverage the specialty pharmacy or the cost plus model. The program does require a 60-day lead time. And that 60 days is kicked off from the moment that the employer has signed the agreement or the addendum to the agreement to implement the program. We are able to provide quarterly reporting, which will give you and your customers exact details on the savings of the program. We are seeing with our preferred stop loss partners additional decrements on the price of the stop loss premiums if this program is turned on, and that applies whether there are any claimants that would be eligible today or if it's just being leveraged as a preventative measure for a claim that could potentially hit the plan at some point in the future. Lastly, on this slide, for the manufacturer's assistance program, there is a percentage of savings fee. So that is 30% of savings up to a maximum of $6,000 per infusion. So that fee is capped. If the specialty pharmacy dispensing or the cost plus program is leveraged, there is no fee to the plan. The only cost of the program is going to be the actual cost of the drugs that are dispensed, and we do charge a hourly case advocacy fee for all of the tremendous work that our team does to hold the member's hand throughout this entire process to assure there's no disruption to care and no issues with the provider. All righty. So that is it. I see a flood of questions coming in, which is fantastic. So I will go ahead and pick one, and either Tammy or I will answer. So the first one is, will the recording slides be sent to registered attendees? Yes. This webinar is being recorded, and we will make sure that it gets out to the individuals that are either registered or interested in watching the recording. Tammy, it looks like there's a question. Can you maybe talk to us about some of the common pushback we may get from providers during this product or process?
Yeah, absolutely. So, I mean, some of the common pushback that we do get is, the members' treatment. I see that there's a question in here, and what happens if somebody is requiring treatment, in 7 days? How do we handle that? The prior authorization process is the exact same, so we can expedite a PA. Our clinical team will still engage with the member. They'll still engage with the provider. All the same steps will happen. If somebody does qualify for the manufacturer program, the manufacturers can send extra drug to the provider to replace that drug. So that's something that can happen. So it can be done on the back end. When pushback does happen, with a provider not wanting to engage, it's just a continuous communication with them. Our clinical team is set up, and they're prepared for that pushback. And again, we have all of the embedded SPD language that we utilize. We have the authorization that has been altered to reflect the SPD language. I think that is so important. The members are educated on it. And also, I think there was a question about here, what if manufacturers do call in and they do hear that, these are a covered benefit? That is a great question. And we do get that a lot. And that's kind of why other infusion, other products or programs have, they don't always work. And what's different with ours is the SPD language is embedded in there. And also our member experience team is educated on exactly how to handle those calls, and they're routed in the correct way. So no manufacturer is given that this is a covered, benefit through buy and bill or anything like that. They walk them right through the SPD language.
Yep. Yeah, to put a finer point on that, these are excluded. They're not covered benefits. They are never paid for by the medical plan. They are excluded by the medical plan. And that language is included in the SPD. Looks like there's another question on here. Is this service available nationwide? Yes, it is available nationwide. We have employers all over the country that are leveraging this program. And there is no restriction on the situs of the employer to leverage this type of solution. There's another question in here. Who is the vendor? So we partner on the specialty pharmacy side with an actual pharmacy. That pharmacy organization is called OptiMed Health Partners. They are a preferred specialty pharmacy for this program. There's another question in here about networks. So at the end of the day, this program is available for networks nationwide. This is really a plan benefit design element. I know there's a lot of questions about large national BUCA networks. This is really a shift from what's covered by the medical plan to what's covered by the pharmacy plan. This is not there are not restrictions based on the network due to the fact that this is the employer's decision on how they structure their benefits. All righty. There's another clarifying question on the cost of the percentage of savings fees. So it is, just to be clear, the fee is 30% of savings on each infusion. So if there's 6 infusions, that 30% of savings would be charged on each infusion, up to a maximum fee of $6,000 per infusion. And then as a reminder, the specialty pharmacy dispensing and the cost plus program, there is no fee. It is simply just the cost of the medication that is charged to the client. So we work with there's another question in the chat. It looks like who provides the patient assistance program and what are their hours? So again, we partner with our preferred specialty pharmacy, OptiMed. They actually have a full team of PharmDs that review each of these cases and work closely with our advocacy team. Their care advocacy and ours work together with the patient and the physician to submit the patient assistance program. And their pharmacy and care advocacy team are open 12 hours a day from 8 a.m. till 8 p.m. See. All right, there's another question. How do you handle PA when chemo from diagnosis to treatment can be as short as 7 days? Tammy, you want to take that one?
Yeah, yep. And like I kind of answered that already, but really we can, expedite the prior authorization process just like we normally would with somebody not involved in this program. So the prior auth can happen and then everything can be done on the back end. Patient assistant program can fall into place on the back end. Negotiation can come through on the back end. We will start to work with the provider right away. So it will be expedited. The prior authorization letter will reflect the language. And so nobody is delayed care. Nobody is asked to make sure that something is into place before they receive care. So the authorization process will be completed just as it is today.
Yeah. All righty. Another question. What data is needed to run a proposal or a savings analysis? So in an ideal world, which is not most situations, if we can get a claim file that includes the uh, specific J code as well as the NDC code or the number of units, um, the billed and the allowed amount and the paid amount, we are able to run a savings analysis off of that information. If you have fully insured customers where you are not getting that level of claims data, or even level funded employers that are not getting that level of claims information, if you do have top 25 drug report, we are able to at least identify which drugs would be eligible for which of the programs. We can certainly, if there's dosing information included in there, can give you as of that day what the AWP price is if there is not a manufacturer's assistance program that's able to defer that cost. Takes about 10 days to get those savings analyses. If you have current customers with Health EZ that are going to be looking at their renewal pricing from a stop loss perspective, as well as their just overall renewal for the fourth quarter, strongly encourage to work with your account executive or your sales rep to get those savings analyses in. We can get those turned around, like I said, in 10 days, and we can make sure that that program is included in your renewal. Okay, we got time for a couple more. In that same vein, what if they do not enter into an agreement as the provider and bill? We have not had that happen. So every case that we've had for this program so far, we have not had a situation where the provider doesn't end up working with the program. It's really important that we're leveraging that prior authorization letter to explain how they can get the claim covered. But we've also made it very simple for them to submit to get reimbursed. So we have not had an issue where the provider won't enter into an agreement. We have had situations where the provider tries to build a medical plan. Tammy already addressed that. It's an excluded benefit. They do get a denial with custom messaging that tells them where to resubmit and how they can get that reimbursed. So we really try to leverage our experience. We own a PPO network. We work with providers and health systems every day. Our goal is to just make sure that these treatments are at a fair and reasonable and equitable price. And so the inclusion of all three options really gives the provider multiple solutions in order to secure the reimbursement to cover the cost of that infusion. All righty. There's a few additional questions, but we want to make sure we don't go over the half an hour. So we will make sure there's follow-up to any of you that we were unable to get to your question as part of follow-up from our account and sales team. As I mentioned, the recording will be available so that you can share this with people in your office or employer groups. And we are really looking forward to continuing to help our customers save money. So thank you all and have a wonderful day.
Thank you.